A bunch of people have reached out, so let's talk about Contrave. A few people reached out on my last TikTok video where I was explaining how Contrave has made me feel amazing. If you're struggling with weight loss, lack of focus, lack of motivation, Contrave might be a good option for you. So what is Contrave? Contrave is a combination of two different medications, bupropion, or Wellbutrin, and naltrexone. Bupropion boosts dopamine and norepinephrine. It helps with mood, focus, and motivation. And naltrexone blocks opioid receptors, which can help with pain, inflammation, and help reduce food cravings. To briefly summarize, naltrexone helps block some of that reward center in the brain, which can really help with food cravings, alcohol, or even tobacco use. Also, bupropion is commonly prescribed to help with nicotine addiction or those that smoke. When used together, they can really help people lose weight, stay focused, and keep their life on track. Now, I shared my story about my ADHD and how it's helped me. It's really important to understand that those with ADHD or ADD typically lack dopamine. And because bupropion is a dopamine reuptake inhibitor, that means it's going to help block the reuptake of dopamine, so there's more dopamine circulating in your system. So for those that experience a lot of brain fog, difficulties concentrating or getting things done at work or with chores or anything like that at home, it's really going to help motivate you and keep you focused to get those things done. One of the questions I was asked is who can prescribe Contrave? Those that are most comfortable with it might be your primary care doctor or a psychiatrist or a mental health nurse practitioner. You have to know that there's quite a few contraindications as well. Some of the contraindications where people should not take Contrave are those with high blood pressure, those with seizure disorders, those that are on opioids or have an opioid abuse problem, or those with an eating disorder like bulimia or anorexia. Also, those that are pregnant or breastfeeding obviously should not be on treatment. Some of the common side effects you may see: constipation, increased blood pressure and heart rate, insomnia. The medication does act like a stimulant in effect, but it's not a controlled substance. So those that lack motivation, it helps give them energy and helps keep them focused and on track. We can prescribe compounded Contrave, which is bupropion and naltrexone, that's combined into one capsule. The dosing is typically once in the morning, and if you are tolerant, sometimes the dose goes up to twice daily. Please keep in mind that this video is simply educational and I'm not giving anyone medical advice. If you are having any symptoms of ADD, ADHD, depression, anxiety, please go see a mental health professional or your primary care doctor or a healthcare professional that can get you the help that you need. And as always, we hope you feel better. In a zip.